Hi, welcome back to Dr. Noah's YouTube update, and we're going to talk about a little bit about traumatic brain injury. March is actually, it's kind of, I guess every disease and problem has the month. You know, they have breast cancer month, but they have traumatic brain injury month, and that's in March. And so, kind of do a little presentation about some of the cutting-edge things that are out there that have had good results with, you know, patients, but also with soldiers at the pathway home. They have traumatic brain injury and post-traumatic stress disorder. So, just a little statistics: 1.7 million people have this kind of problems, and it's actually probably about 10 times more. The current research showing that even mild type of jolting to your head, you don't have to, you know, get dizzy and blackouts and all this kind of stuff to have some possible negative consequences of having trauma to your brain. There was a big conference down in San Diego with all the big neurologists, and of course they have nothing to provide, but you know, they make lots of money doing nothing. But anyway, what was kind of interesting, one of the big breakthroughs is that, yeah, we have to really start to customize our diagnosis and treatment to the patient. Oh my God, you know, so none of this more gross type of, you know, they used to have a category and they used to drug people for no benefit like that. So they're actually taking some of the tenets of holistic medicine, that everybody is unique and special, and that's what you have to do. Just like everybody has a special fingerprint, it has to be customized. Even at least the neurologists with traumatic brain injuries are kind of going like that. So 52,000 people die, you know, almost 1 million people are hospitalized, and so that's it. Most of them are caused by falls, motor vehicle accidents, struck against different type of things, assaults, and like I said, most of the things I see are soldiers that are blown up or fall out of a helicopter. You know, they hand-to-hand combat and then get hit with a rifle or butt or a handgun or something like that. So those are what I kind of see. Highest risk, males are 150% more likely to have this than females. That's probably true with this, maybe with other types of conflict, but you know, with sports, I know my daughters playing in soccer and field hockey like that are definitely getting up there in terms of getting banged around like that. So age groups of highest risk are from 0 to 4 and 15 to 19. Certain military duties like paratroopers or Navy SEALs, Rangers, this type of people, increased risk of sustaining TBI. The military is actually starting to really pay attention to this. They kind of poo-pooed it. That's what I've unfortunately seen. They go in, you know, and you know, the stories are pretty much the same, which makes kind of sense, you know. So here you are in a military firefight, you know. You can't do like a timeout. Okay, let's bandage their head. Let's take them to the hospital. They have to just kind of deal with it. They have to get their buddy to, you know, try to revive him or her, get him back on, you know, some type of safety area like that. And then sometimes, depending on special op guys, you know, they don't come back for a week or two, so they don't get any attention right away. There's kind of a golden time. The sooner that you deal with these problems, the better. So as we'll talk about. According to one study, 40% of those hospitalized with traumatic brain injury had at least one unmet need services 1 year after that. Memory and problem solving, stress, emotional upsets, temper, and job problems. And that's definitely what I see with the soldiers there. They've been, you know, great soldiers. They've had this type of problem, and then their personality change, you know, and then they become very remote. Plus they have post-traumatic stress disorder. And so these people get into trouble, they lose their job, they're homeless, they get in a problem with the law, so it's a really kind of tragic type of situation there. So let's see, here's this study that was just done May 19th at the Mayo Clinic at a conference like that to test the gauge of severity of concussions. Is, you know, the old notion of doing some neurological type of stuff doesn't always pick up things. Once again, you don't have to black out, you don't have to have your head hurt to have these consequences. Well, what they're looking at, the American Academy of Neurology, once again down in San Diego, is looking at, which is something that, you know, my profession actually has looked at, and there's other type of systems out there, heart rate variability. This is a way to look at the autonomic nervous system, and so by looking at your pulse wave and how your heart kind of is affected, we're able to get an insight into how that kind of works. So that's kind of exciting. That's what my profession has been doing for at least the last 15 years. Low cognitive scores and risk of brain injury, definitely, once again, long-term consequences on how well you do in your job performance in school. So, you know, these are big factors in terms of, once again, having people change their lives, pretty dramatic like that. We can put that. So what to do? Well, I like a couple things. One is what we talked about. L-arginine. It's an amino acid. It has, once again, lots of healing properties. Little things it does: it lowers blood pressure, lowers cholesterol, helps with diabetes, sexual dysfunction, reduces clots and strokes, improves heart failure, wound healing, kidney, and improves memory and muscle growth. So that's a pretty nice type of thing, and that's probably you don't hear from it when you go to your drug doctor, because it does a lot of good things, no bad things, and it doesn't cost a lot. So there's a number of studies out there like this one. This was published in a Journal of Pharmacology and Experimental Therapeutics. Once again, real science. Neuroprotective effects of L-arginine administered after cortical impact in rats. The reason we use rats is because it's kind of hard to do a study where we whack John over there and then we look at his brain, open his brain up, cut it into little pieces. Yeah, that's not going to be a good day for John. So we use rats. And dose response and time window. And this study showed that, once again, this seems to be helpful. The sooner you do it, the better. These type of nutrients, once again, is like a magic force field around the brain cells, so less and less of the brain cells happen. Just like when you smack your hands, things start to swell up. Well, that happens into your brain. Well, and because your brain is made of this hard bone, it can't go anywhere. When you bang your thumb, it swells up and only has the ear, so it can get really big, 3, 4, 5 times bigger. Well, that doesn't happen, so then that pressure starts to cause more necrosis or more damage. So all these type of natural type of things out there help kind of protect, just like a farmer, when it starts to freeze, they start to go and they actually water the plants to put ice around it, because that's actually a more protective effect than the cold temperatures. So L-arginine, great type of nutrients to kind of do that. We'll jump around a little bit. Low-level lasers, once again, things that drug doctors hate, because this is what using energy medicine. So using low-level energy for closed-head traumatic brain injury in mice, and showing that different wave sense. And this was published in Lasers Surgical Medicine 2012. So very cutting edge like that. Using in my practice, lots of people do it. So by using these other type of electromagnetic forces, just really, once again, makes drug doctors bonkers, because they're all into drugs. And you use something outside even the biochemical area. Sometimes they can figure out, okay, L-arginine, yeah, that's right. 3 people got the Nobel Prize award, so maybe there's something to it. So maybe we'll pay attention to it. And nitric oxides. So that's, once again, real effective. I use that in my practice and on the soldiers. So that's kind of nice. There's different types of hormones. That progesterone, which I did not know. Progesterone is a hormone that mostly in women has to do with pregnancy and stuff like that. Facilitates cognitive recovery and reduces secondary neuronal loss and cortical contusions, injuries in male rats like that. Long word for saying this hormone seems to have a real positive effect, and that was published in Experimental Neurology, 1994. So that's been around. One of the, probably about 4 or 5 years ago. So melatonin's been around for a lot. It's produced actually into your brain, has to do with sleep. Well, I happened to listen to, and I forget the professor, he's the foremost authority on melatonin. He just goes on, and melatonin is like, the magic, thing. Everybody should be taking melatonin because the environment and light like that, wonderful effects. But sure enough, melatonin secretion after head injury is a pilot study. Yeah, this was published in 2006 Brain Injury, showing that melatonin, once again, has a protective effect in terms of helping the brain either protect itself or, once again, reestablish itself after it's once kind of worked like that. So that was kind of an interesting thing. Here's actually a great study, aerobic exercise. Yep, so exercise has an important factor like this in terms of helping integrate, once again, the nervous system up in the brain. Neuroprotective effect of pycnogenol. It's a French pine bark. Once again, has real strong antioxidant type of properties like that. So following traumatic brain injury, experimental neurology. A real hot one is resveratrol. Neuroprotective effect of resveratrol against traumatic brain injury. So the point is that there's lots of natural things that actually have good science, and you should be doing, because the drug industry, the drug doctors have nothing. They have nothing. They might put you on a lot of steroids and stuff, but once again, that's not what's going to be the long-term kind of beneficial for effect. One that I've had the good honor to doctor up in Sacramento, another colleague of mine, a chiropractor. She has a hyperbaric oxygen chamber, so that's really kind of exciting, and that's been used for a long time for different types of strokes, head injuries, and this is a randomized controlled studies of what's called neuroplasticity. Your brain is now considered more, instead of like a hard factor, so when it gets broken and just shatters, is that, like with plastic, it's deformed, but we can kind of reconstruct that. Targeted oxidative blocker prevents secondary. I just bring that up because, yeah, the drug industry is going out there trying to find drugs that, once again, have to do with oxidative stress. And we've talked about Protandim, resveratrol, pycnogenol. These are all natural things that aren't going to cost, $3,000 a month in terms like that. And the last of these nutrients is curcumin or turmeric. So very powerful. So dietary curcumin counteracts the outcome of traumatic brain injury and oxidative stress, synaptic plasticity and cognition, and that was published in Annals of Neurology, November 2000. So very, very, once again, exciting type of technology. If this happens to you, you need to find someone like myself and other doctors that are really into natural and functional medicine to be able to protect you. Otherwise, you're wasting your time and money, and then you'll pay the consequences, which wasn't discussed. Now there's a direct link. The more head injuries you have, the more type of neurodegenerative diseases. So look at Muhammad Ali, Parkinson's disease, pretty classic, and other football players, dementia, and Alzheimer's. So those are, once again, a direct correlation as the more banged up head you have. So if that has happened, you need to be doing active things because, once again, the largest conference in December 2012, right back in our backyard here, said there's nothing for Alzheimer's dementia. But hey, it costs $90,000 a year doing nothing. So lots of money, no benefits. Check out some of my YouTubes about people that had those problems and actually would have helped. Talk to you soon.